in our differential diagnosis of a patient with, let's say, back pain on one side and into the hip musculature, and maybe some leg pain down the outside of the leg or even on the inside of the leg, our physical exam must include a very thorough palpation and joint mobilizations of the spine. And the trick of some of this differential diagnosis may look like this. Part of our central pressures will be going down each specific vertebrae and going from gentle to deep to deeper and all the way at the deepest point. Of course, I'm being very careful as to how deep and firm I press, but I'm always listening to the patient's signs and symptoms. Then I would do my unilateral pressures with my thumbs, feeling and getting deep into the multifidus muscle, then through the multifidus and into the facet joints of the lumbar spine. And I work my way up from L5, S1, and now I'm on L4, L5 facet joint. And as you can see, I'm fiddling around to look for pain. And I'm asking the patient to tell me about any symptoms that come on while I'm pushing on the lumbar spine. This is a great way to rule out the lumbar spine as a source of hip pain, or rule it in if this brings on the pain that the patient is complaining of in their leg. This would then therefore tell us that their lumbar spine is reproducing their gluteal and leg pain. I may even ask the patient to come up onto the elbows, and now I'm maximally closing up those facet joints, and may, to even rule it out further, have you side bend a little bit over to the right, and really investigating and trying to reproduce the symptoms. Go ahead and go down. If it does not bring on symptoms, and I've palpated thoroughly in flexion and in extension like I just showed, then I would simply rule out the lumbar spine as a possible source of leg pain. Or if it brought the symptoms on, then we know that the lumbar spine needs to be treated.